Hi, good afternoon. This is Carla. I am currently waiting for Dr. Solomon to log in, to request to join the live. So here he is, Dr. Solomon. 1 second. Hi, Dr. Solomon. How are you today?
I'm great. Thanks so much for having me. How are you?
Oh, just in the middle of quarantine with my cat Darcy. For joining this live. For those of you that don't know, this is Dr. Solomon. And I would just want to give a shout out to my friend Maddie. She's the one who connected us for this live today. So thank you, Maddie. And without further ado, I'm just gonna give a few minutes to Dr. Solomon just to introduce himself and just tell us how amazing he is right now.
I don't know about all that. I'm just happy to be here with you guys and answer your questions and give you some more information about what everyone's going through right now. It's a really tough time. It's been 2 weeks since we've all been kind of in our homes, and I know a lot of people are going stir crazy and home with children and having to become teachers, take care of their family at the same time. So I'm in this with you guys, and I'm here for you today. I'm an emergency physician, ER doctor here in Los Angeles. I work in 2 different hospitals here. I'm also a clinical faculty and assistant professor of medicine down at Harbor UCLA, where I teach residents as well. So I've been on the front lines of this, and we're starting this. It's good timing that we're doing this because it's going to really start picking up soon.
Oh man, so you're a Bruin as well. I'm a Bruin too.
Oh,
yes, Bruins. Yeah. Yes, so we're just going to start, cut to the chase.
Sure.
Dr. Solomon, what is the difference between COVID-19 and the common flu?
Sure, absolutely. So COVID-19 is actually a nickname, right? So it stands for a coronavirus is a coronavirus disease discovered in 2019. So that's the nickname COVID-19. It was discovered New Year's Eve, so December 31st, just barely made it in 2019. It was discovered. Yeah, it was discovered. The first case was reported in China, in the Hubei province, in a city called Wuhan. So you may have heard in the news about this city called Wuhan, and that's where the first case was reported. The actual name of the real virus is SARS coronavirus 2, but we call it COVID-19 in the media, and that's the nickname that it's been given. It's a virus, and it's part of the coronavirus family. So with coronaviruses, a lot of them aren't really that bad. They just kind of cause the common cold symptoms, a little bit of fever, sore throat, runny nose. But this is a brand new virus. We've never seen it before, and it just started at the end of December in 2019. So there's a lot of misinformation that you were talking about, and the reason there's a lot of misinformation is that it's brand new. So we're kind of learning about this, as doctors, just as the community is in kind of real time. And this is why it's the importance, to go to your trusted news outlets that you like to get ongoing information about it. And a little bit of background on it is it's now spread, from that one city in China, and it's on every continent of the Earth right now except Antarctica. So it's everywhere. And it's been spreading very rapidly since the end of December. And it's, compared to flu, it's anywhere from 6 to 20 times more deadly than the flu. Right, so flu is usually responsible. This last flu season that is kind of ending right now was responsible for a little bit over 20,000 deaths in the United States, and we're kind of already starting to surpass this right now with COVID-19. And I think the reason it's particularly bad is because it can get anyone sick of any age, but people over the age of 65. And also people with chronic disease such as diabetes, high blood pressure, lung and kidney disease, heart disease, and cancer. Those are the big categories. Do not do well with this disease. And actually there's a lot of people are dying, people that are the elderly over age 65 and the people with those chronic medical conditions. So it's our part as a community for all of us to stay well, especially to protect, those vulnerable populations, right? So it's a serious disease. People can remain calm, but at the same point, it is serious. And 1 out of every 6 to 1 out of every 8 people over the age of 80 are dying from this. So it's a really big deal. And a few things I just want to mention too, in terms of the symptoms. The symptoms are pretty similar to the flu. Originally, it was just fever, cough, shortness of breath, but we're discovering as the months go on that nausea, belly, abdominal pain, diarrhea, and even a change in your smell and taste can all be symptoms of this virus. So it's not just your fever, cough. You could still have this virus even with minimal symptoms, like just a little bit of sore throat or runny nose even. Or you can have the disease they're discovering and have no symptoms at all, which are called asymptomatic people. And to be honest, about 25 to 50% of people that have zero symptoms can still infect other people. So that's why this is such a tricky disease, because it can spread so rapidly even if you don't have symptoms. And in terms of my overview of this, I just want to wrap with my overview of COVID-19, in that the updated numbers as of this morning, we're approaching 1 million people in the world that are infected right now, or have been infected over the last few months. And there's been over 45,000 deaths worldwide from this. In the United States, we're at 200,000 cases and at about 4,000 deaths in the United States already. And we're expected to be much higher throughout the month of April. April is going to be a tough month for us. So.
I see. And people are asking, why, like in this strain of coronavirus has caused so much havoc in the world compared to a H1N1, for example, that happened like a decade ago.
Sure.
Why is this one causing so much anxiety?
I think because of kind of what we talked about, the really severe disease in the elderly and in the vulnerable populations that have chronic illness. About 5% of people that get it can get this really critical disease that can cause, a severe pneumonia. It can cause you to have, really massive amounts of inflammation in your lungs to the point where you can't breathe. You need to be intubated sometimes and put on a ventilator. So, we're seeing the people that do get sick get very, very sick. And we're seeing 20, 30-year-olds that have stopped breathing from this. But, the majority of people that are at the highest risk, as I mentioned, are the very elderly and the people that are sick at baseline. But, this can lead to shock and death. And about 5% of people that are getting it get to this point where they can have this really severe disease or death, really bad pneumonia from it. So I think that's the big scary point of this. And, we all have loved ones that are elderly and we want to take good care of them. So I think, that fear for both our own safety and our family members is such a trigger. And I'm there with you. I have parents close by here in Los Angeles, and I worry about their health too, and family members, friends, and of course my colleagues and me when we're on the front lines. But Los Angeles and the state of California, we knew about this early, and we're doing a good job preparing. And happy to talk about more about how to keep yourself and your loved ones healthy too.
Talking about like how to keep ourselves and our loved ones safe and in the community, the community that we live in. What are, we all know that social distancing right now is the big, the flatten the curve that we're supposed to do that in order to literally save ourselves and others. But besides social distancing, what else, what methods can we do for those of us that have no choice but to go to work, because we're essential workers, or, we have to go to the grocery store, and as we know, it's impacted in every grocery store nowadays. So what can we, besides social distancing, also do in order to protect ourselves and others?
Sure. I think, all important points that I just want to harp in terms of everyone watching today and everyone that hopefully will watch and are keeping up with the news is that it's really spread person to person, right? So it's called droplet transmission, which means that small spit particles, right, from coughing or even talking to someone up close, up until a 6-foot radius, you can spread this person to person, even if you have no symptoms at all. So right now, what we're telling the community is that everyone should behave as if they have it and really try to keep distance from one another to prevent that person-to-person spread, because that's the main way to really spread this right now. So remember, coughing, talking, sneezing, and it can also, if you cough, say, onto a surface of a table or if you cough onto anything around you and you touch that, and then you happen to touch your face, that's also another way it can be spread, because these spit particles, these little small spit particles that we can't even see sometimes, will end up on surfaces, and then we touch our face, our eyes, our nose, our mouth, and then boom, we have it. So that's the basic concept of why social distancing is so important, right? Because that's how it's spread. So we're really recommending everyone stay home. Please stay home right now if you can. 80% of the United States right now is under a stay-at-home order because of how serious this is. So we're saying that you should really, there are, of course, some people have to work. They have to do their job. Essential workers are allowed to work. But if there's any way where you can possibly stay home, please try to stay home. People are saying to only really leave home for emergency situations where you absolutely have to go to the hospital. But we're saying if that's the instance, please call the nearest hospital first before you show up. You can discuss anything on the phone with us at any time, us providers. But just showing up at hospitals right now is dangerous because that's where all the COVID patients are. And you don't want to be exposed to that, right? So hospitals and emergency care are one reason to leave the home, but also pharmacy, if you need to go to the pharmacy to pick up medications. Forbid you need to go get food from the store. I completely understand that. Or if you need to go to the bank. So those are the big reasons to leave your home, but otherwise people really should stay home right now. And when you're out in public, please try to keep a distance from people. They say at a minimum 6 feet from everyone when you're out in public. And that's kind of the concept of social distancing, is when you're in a social environment, and anytime you're outside is a potential social environment, right? So when you're outside, you want to keep at least 6 feet from anyone. But if forbid you're in a tight space and you're going to be closer than 6 feet to people, you should wear a mask. And we can get into that a little bit more. And lastly, I want to talk to you. People may have heard the concept of flattening the curve. They're kind of talking about that in the media a lot. That goes hand in hand with social distancing. And the concept of flattening the curve is that they've done projections already, and they know how many people in the U.S. are going to be infected. And they actually have a pretty good projections. We know how many people in the world are going to be infected. The problem is it's going to absolutely destroy the healthcare system in this country if everyone gets sick right now at the exact same time, because we'll be overwhelmed in the hospital. We won't have enough stuff to take care of you and supplies to take care of us and you, that it would be really, really a bad thing for the healthcare in this country. So flattening the curve means, by social distancing and all of us doing our part, we can spread that out over time. And instead of everyone getting sick within this next few weeks, we can spread that out in terms of people getting sick over the next few months. Then we can manage it in the hospital and actually have time to develop vaccines and treatments for this thing.
And in regards to mask, and in regards to the real mask that protect, the N95s, those are, for the front line, like yourself, doctors, nurses, people that clean the hospitals and etc.
Right.
But, is it something that we, the public, should also carry and use quite regularly? And although we, N95s, they might not be available right now. They're not even available to doctors and nurses. How are cloth masks, for example, how effective those are? I know lawyers like my friend, the lawyers that are going to court right now, they're starting to use diaper mask in order to have something much stronger in court. So how is that something that we should do as the public? How effective is even a cloth mask?
Sure.
What should we do?
Sure. Great questions. And I'll start with N95. So N95 masks should only be used by healthcare providers right now, because those are to prevent airborne transmission of a particular virus. And we are at risk for that in the hospital when we're doing particular procedures on a patient's airway. And we're the really only people at risk for that airborne transmission. So the N95 masks, if you have them, this is a plea to everyone watching and listening right now. If you have N95 masks that are in good shape, please consider donating those to your local hospital. We are in need You guys might be hearing that we're running low on supplies, even in America here. First world country with all these resources, and we're running low. We really are, because all these patients are getting so critically sick at the same time. So, any surgical masks or face mask, and specifically N95 masks or face shields, we would all really appreciate donations. That being said, in terms of everyone wearing masks in the community, this is actually a hotly debated topic right now, literally happening in real time. As you guys know, we're learning about this every day in real time, just like you guys are. There's mixed beliefs in the academic community and scientific community of whether the general population should wear masks. If you have access to basic medical masks or surgical masks, like your standard ones, I recommend it's probably a good idea to do it, especially as we were talking about, if you're in an instance where you're going to be closer to people less than 6 feet. If people in close proximity, really close to you, that's when you need to wear your masks, right? In terms of the actual masks themselves, I know a lot of people, including the person I'm speaking to, Carla, included, are interested in creating masks for people during this time of need, and thank you guys for your service. It's really great. But the exact makeup of the masks, I can look that up and get back to you, because I think that's still being determined right now in terms of how many layers of cloth, the exact composition that you need for them. But that's going to be actually probably coming up soon. I would imagine in the next few days, as the CDC and the World Health Organization continue to release updates on that. I also, we talked about this before this week, before this presentation, the concept of doing the 5, right? You'll see this sometimes on Google. Instagram is now doing public health announcements about doing the 5. And the 5 it's your hands, so make sure good hand washing, everybody. Make sure you wash your hands, especially forbid if you're going to touch your face. But in general, the second one, so good hand washing, don't touch your face. If you need to cough or sneeze, do it into your elbow, kind of like this. Because what happens is if you cough into your hands, shake hands with people, that's how it gets spread, right? Another one is space, so keep 6 feet from each other. And then home, so stay at home. So those are kind of the big 5 things in terms of everyday stuff you can do. Supplies are limited on hand sanitizer, I know, but your alcohol-based hand sanitizers work and kill this disease as well. Make sure you do good alcohol-based cleansers for your home and in your kitchen, in your dining room, any places that you may eat.
Yep. And I know Alma had a question. Like, how many times can we reuse a standard, for example, normal mask or surgical mask?
Great question. So that's difficult, and the easiest answer is it depends. So it depends on if it's wet or not. So if you're really sneezing and your nose is running a lot and you're seeing that the outside of your mask may be getting wet, then you're actually at higher risk, because the barrier breaks down and it can trap particles from the outside. So as long as your mask is dry, it'll be effective. And so that's usually, basic talking. If you're talking for an hour, usually basic talking will get it wet after about an hour, at most maybe 2 hours. So these masks, remember, you want to probably change every 1 to 2 hours, unless it gets wet, then I would change it sooner.
So you mentioned that this disease, it's sort of like both. It's very symptomatic, but also asymptomatic. So you can either have it very severely and you have it, or you can think, or you might just think that you have like allergies, and you might just be spreading it to everybody, and you don't, take care of it because you don't think it's a big deal, or simply you have it in you and you will never know because you never feel it.
Right.
If we, like in the normal public, do get sick, right? And then we know that we've been not social distancing, and we know that, or we've been working, or we've been like directly exposed. What should we do?
Sure. I think we'll do that. I'll handle that question in terms of severity. So say you're walking around and you get exposed, someone coughs near you, geez forbid they cough on your face or anything scary like that. You're not feeling any symptoms, but that happened and someone coughed in my face, right? So that's an exposure. So that, in that instance, and this is where the concept of home quarantine versus home isolation comes in, right? So everyone right now should be staying at home as much as possible. I'm in it with you. It sucks. Trust me, I'm doing it too. It sucks. I want to go outside as much as I can, but we should all be home right now. But then if you get exposed, that's kind of the next level where someone coughs on you, geez, you may have it. So then you kind of go up a level into home quarantine, which is like, okay, you shouldn't leave the house for any reason. If you need medical supplies, hopefully a friend that hasn't been exposed can bring you medical supplies. They can bring you food. It's all about social networking. We got to be there for each other in our time of need. But remember, home quarantine means you should stay home if you're exposed. If you are going to get sick, the majority of people get sick within 4 to 5 days of being exposed. So say someone coughs in my face, high likelihood within those first 4 or 5 days is when I'm going to get sick. But the tricky thing and why this is spreading so rapidly is that there's a delay sometimes up until 2 weeks from when you get coughed in the face to when you actually start feeling your symptoms. So up until 2 weeks, is tricky. And that's how long you should be on home quarantine for. We say 2 weeks just in case it takes time for it to develop in an individual person. Right. And in that instance, your gut instinct is going to tell you, okay, run to the doctor, go get tested to find this out. But please do not go to the doctor or the hospital to get tested. If you get sick, assume that you have it. It could be another virus, of course. There's still other viruses going around, like the common cold right now. We're still seeing flu right now. But at this point, in terms of precautions, if you get sick, you should assume that you have COVID-19. Right. And so I wouldn't recommend testing because, geez, forbid you have one of these other viruses. You go to the hospital and you're around everyone who has it. Right. And then you have a chance of even getting sicker. And we also have limited tests right now. Regardless of what you hear from the government, we do not have tests for everyone right now. And that sucks. I can't even get tested right now if I'm asymptomatic. Right. We're only testing people that are either healthcare workers with symptoms, or if you're over the age of 65, or you're one of those people with severe medical problems. Those are the only ones that are getting tested, even if you do show up to the hospital, unfortunately. That may change as more tests are becoming available, but as of right now, if you get sick, please stay home, and that'll be the best for your health, the health of the community, and as healthcare providers trying to take care of you guys.
This is a question from Savvy. Is it known yet how long the virus can live on cloth or fabric?
Very good question. Thank you. As we know, a lot of these studies that are coming out have mixed information. So I can give you overall best guesses right now, and I'm hearing repeatedly that 3 days seems to be how long the viruses can last on certain surfaces. So surfaces made of certain metals like steel, the virus can be alive on there for 3 days, believe it or not. Whereas wood and other surfaces, it's about 1 or 2 days. But that's largely not known for sure, right? So it can be up to maybe even 4 or 5 days. But as of right now, the general agreement is about 3 days, right? Yeah. And then also, I wanted to close that last set of questions with when you get sick. So we had mentioned not going to the hospital, not getting tested. But if you get sick, then you switch from that home quarantine that we talked about where you're not leaving the house to home isolation, which means you're not leaving your room. Right? So you're going to be in your own room away from your other family members. Because if you're sick, you don't want to get anyone else that's in your house, forbid anyone elderly or anyone with chronic medical conditions, or really anyone. You don't want to get them out. You don't want to get them sick. So really you have to do home isolation if you start having symptoms right now. Okay? Even if you get sick, remember it's a virus. There's no treatment. It just takes time and rest. Different treatments are being explored, but the majority of people will do okay and will make it through this, okay? Yeah. And if you're sick, one thing you can do is if you're having joint pain, because a lot of people get body aches with this, you can take Tylenol. So some studies are showing that Advil, another name for it is Motrin or ibuprofen, that may not be the best medicine right now because some people, there's a thought that it interacts with the same receptors that the virus does. So if you're going to do one or the other, you're probably going to be okay taking Advil, but I would recommend probably Tylenol instead right now for fever or pain.
Yeah. And in, like, everybody, it's under the impression, well, not everybody, but a lot of us are under the impression, okay, if we stay put, if we stay at home, if we don't do this, we don't do that, then the quarantine eventually is going to be over.
Right.
The social distancing is going to be over. But there's a lot of okay, it's going to be over. We're all going to go back to normal and we can forget about this ordeal. Is this virus kind of like the common flu that is cyclical, that it will come back eventually? Are we going to have another round? How does that work?
I pray we don't. I'm like everyone. I hope this thing disappears. I think, China is actually seeing a big turnaround right now. As you know, they have a lot of oversight with their government, and they're really hitting social distancing well, and they're hitting it early, and they're actually not seeing a ton of new cases right now. So if we do our part, the cases will eventually go away. However, the longer that it sticks around, it has a chance of continuing to mutate. And when it starts mutating, it already has mutated a few times, but thankfully it's still similar to its original form. But the more it mutates, the more at risk we all are of having a vaccine that maybe doesn't work that well for it. And it can, as we know with the flu comes every year because it goes back and forth between the northern and southern hemispheres during kind of the winter seasons. It follows the winter seasons, and it kind of keeps, due to travel and everything, it alternates between the northern and southern hemispheres. I hope that this disease doesn't follow suit. It could, though. But I think it's a little early to tell. We're still about a year away from a vaccine for this. So that's, some tough information to give you guys, I know, but it's going to be about a year before we get the vaccine. There are therapies right now that are being explored. You guys have probably heard about chloroquine, hydroxychloroquine. Another name for that is Plaquenil. That combined with an antibiotic called azithromycin is being explored. But remember, these are all experimental right now. We don't have great medicine for any of them. Remdesivir is another one, which is an anticlonal. It's an antibody. And you're even seeing that people who are being sick are donating their plasma with their own natural antibodies after they've had the virus. They're donating their plasma to hospitals too as another option. But right now the treatments are in flux. It's changing every day, even almost every week. But right now there's still no agreed upon treatments, and I really hope it doesn't become cyclical, but it could. It could.
Yeah. And this question is from Miss Jimenita. Doctors that are exposed are not being tested or automatically tested. Mm-hmm. They're not?
So we're all doing a good job in the hospital of wearing our masks and our goggles pretty much for every patient we see right now. So as of right now, it's not mandated because tests are limited. It's not mandated that every physician or healthcare worker gets tested. However, the minute any of us start feeling sick at all, sore throat, runny nose, cough, fever, we can assure you guys that we're letting our superiors know, and we're off work for at least 2 weeks. And in that instance, we're getting tested. But right now, there's so many, there's a shortage of healthcare workers in this country, but there's still enough of us where we can't all just go get routinely tested right now, because then we would have to be doing it. What do we do it every day? Do we do it every week? Even if we're asymptomatic. So right now we're just doing our part, staying with our masks too. We're good about changing our masks and our gowns and our goggles, so we don't forbid asymptomatically give you guys anything as well. But yeah, that's a great point. We're not routinely being tested right now unless we come down with symptoms.
And this question is from Alex. Alex is Rod. Sorry if I butcher that. Why is azithromycin being used? I don't know if I pronounce it correctly.
Sure.
If this is viral, not bacterial.
That's an excellent question. As you guys know, that azithromycin is an antibiotic. Antibiotics work only for bacteria. Sometimes it's given for strep throat. Sometimes it's given for different types of pneumonia. That's when we commonly see this medicine, azithromycin. So what they're doing is they're trying different medicines right now and trying different combinations of medicines in labs to see if it will decrease the viral load or the amount of virus that are in these dishes that they're studying, right? Uh-huh. And for whatever reason, Plaquenil and azithromycin is a combination that they're throwing at it to see if it helps. And they've showed that this combination is showing good benefit in lab settings, and it's reducing the viral load. of this particular virus, the COVID-19. Whether this will translate to better outcomes for patients is unclear, but we're actually starting to see some hospitals adopt this as a combination. I agree with you. I don't understand the mechanism of how azithromycin would work to directly attack the virus. However, azithromycin is an antibiotic in particular that has really strong anti-inflammatory effects. And it may be that part of it, of the azithromycin, the anti-inflammatory part of it, that helps with this. Because remember, the COVID-19 develops those pneumonia, you get those pneumonias, and with the pneumonia, your lungs can fill up with fluid and lots of inflammation, right? So could be the inflammation is the key with the azithromycin.